Hello, everyone. Welcome to the Greater New York Dental Meeting and our presentation on dental hygiene students and the global lens, a case study of student experiences providing dental hygiene services in Grenada. I am Paula Malcomson, and joining me, Shelley Getty. We're both registered dental hygienists. We conducted this research at Fanshawe College in the fall of 2024. This research was conducted on our students, our second-year students that had attended a global outreach in Grenada, providing care, and then entering into the fall into third year. Shelley, can you please share some information about the outreach?
Sure. So, with our outreach, we actually initiated this program back in the summer of 2023. So, a group of four faculty from Fanshawe, including myself, went as a pilot project to help underserved areas and students, and clients in that area. And it was such a wonderful experience. And we thought this would be a great opportunity to bring students the next year. So we took our second year group of second year dental hygienist students in the summer of 2024. We took 12 students with us that time, and it was a fabulous opportunity. And we're actually going to be doing it again this summer. In summer of 2025, I'm taking another eight number of students to go.
Right. What initiated our interest in this research is I am in clinic with the students in third year, and I noticed quite an advancement in their confidence, in their communication skills, just in the first few weeks of school. So I talked to Shelley about the outreach, and this was throughout the class, but I was wondering, is this as a team effort throughout the class? Were these the specific students that were on because a good number were on the outreach, a third of the class, but it was generally a message throughout the class. And so we decided to do some research. So after getting our research ethics through Fanshawe College and sending obviously our consent forms to the students, we conducted interviews in October and November and started our analysis. You can see our interview questions we had quite general questions just about their motivation, their cultural learnings, their impact of their learning and their reflections. And then we asked more skill-specific questions as well. We completed a qualitative study with four participants. We had four participants, and Shelley and I completed the interviews. And then we collected and analyzed that data. So from that data, you can see from our conclusions and future recommendations, we found general themes throughout all of the research participants, that they gained a gratitude for their fortunate Canadian lifestyle, compassion for client cases and for underserviced clients and care, critical thinking skills. They had to make decisions with triaging clients with pain. So they had to, assess quickly and refer appropriately. They had to collaborate in a team, and they noticed mentorship. So they collaborated with each other as classmates, with other team members, including nurses, including other dental hygienists, faculty, of course, with, parents and families, all the stakeholders in the environment. They noticed increased confidence in all of their communication skills, assessment skills. They had improvement in their equity, diversity, and inclusion. So just cultural sensitivity, cultural safety, and all of those elements of informed consent, ensuring that they were coordinating treatment sensitively and correctly with communication and proper cultural context. And they noticed that which I really found interesting, is that their adaptability was increased, which is, you think it was a fantastic skill, that they became more flexible and adaptable because there could be, equipment breakdown, there was climate considerations of extreme heat, and, exhaustion, and just different resources that they're used to. So they all noted that adaptability was a huge context that was improved with them. Shelley, can you maybe mention how this research could be used for future methodology?
Yeah, so one of the issues that we came across when we were doing a literature review before, embarking on this research, was that there really isn't a lot of information, if any, research that specifically addresses dental hygiene students. So I was able to find different resources out there that looked at nursing students, medical doctor students, pharmacy that did global outreach. The only thing that I could find as far as dental hygiene specific research was to do with underserved areas within local communities. Not going onto an international global level. So with that, I found that obviously there's going to be a lot of things that are similar when we have underserved populations anywhere in the world, but having that international piece, I think was could have offer some challenges, like Paula was saying, different cultures, different environments, and different resources that are available on the ground. So that's one thing that I'm really happy with. This particular research that she and I are doing is giving us a dental hygiene specific study that hopefully will be able to help other organizations and educational institutes, across North America in doing something similar with their students because it's been such a fabulous outcome that we've got from this.
Yeah, exactly. What we have noted too I'm going to wrap this up because we're at 5 minutes, but the questions for future dental hygiene graduates, we would love ones that have attended an outreach is, how did this impact maybe in 2 years, 5 years, how did this impact your community involvement? Many of the students have mentioned to Shelley that they want to return as practitioners, not just as students. So has this instilled that service learning and that service commitment for life as a dental hygienist, which would be an incredible study down the road. But in the meantime, we're just hoping to support the continuity of the initiative, and noting that, and Shelley has here noted in our lit review that the global volunteerism and service learning has emerged as a transformative educational strategy in healthcare and in the associated curriculum. These activities can foster social awareness, which definitely was seen in ours, cultural competence, and professional identity, right? So they're proud to be dental hygienists and proud to be, collaborating with other professionals and helping the underserviced communities. So thank you for your time. Shelley, any last words?
No, thank you very much. This has been an amazing opportunity.
Yeah, thank you.